started. So this is our virtual health teaching assignment, and today we're going to be teaching you about Croup.
Okay, so croup is a common childhood illness. It's a viral infection that causes swelling in the upper airways. The swelling can cause changes in the child's voice and interfere with breathing, the child's breathing. Okay, so preventions. It's very contagious, so the bacteria that causes croup makes it spread from person to person. Okay, ways to prevent it: you want to wash your hands regularly. You and your child. You want to clean the your child's toys in between uses. You want to encourage your child to sneeze into their sleeves and cover their mouth when they're coughing. And you want to throw away dirty tissues as soon as you use them, and also keep your child from daycare or school when they're sick.
So a few nursing diagnoses for croups are ineffective airway clearance due to related presence of thick tenacious mucus or edema and constriction of the airway, ineffective breathing patterns due to inflammatory process, or anxiety, which is related to the change in health of the child or the change of environment, like being hospitalized.
For assessment of the virus, physicians and nurses assess the virus in the same manner, including history, respiratory status, general appearance, and the degree of respiratory distress. History involves knowing that the patient does not need a history of respiratory distress or inflammation. Respiratory involves knowing that he has labored breathing, stridor in the lungs, and sounds known as barking while he is coughing or she is coughing. And general appearance includes tiredness from tongue possibly protruding from mouth. He or she would be sweaty, would have a flushed appearance, would be fatigued, and have shallow rapid breathing. For degree of respiratory distress, this would include mild, moderate, and severe croup. Mild is no agitation and occasional barking cough. Moderate would be little or no agitation, frequent barking cough, and severe croup includes anxiety, agitation, client being pale or fatigued, and has frequent barky cough.
So nursing interventions. So what can the parents do? So the parents can encourage oral intake of juice, water, or popsicles to ease the soreness of the throat and prevent dehydration. Um, they can also provide the child with an air humidifier, with the child sitting in the bathroom filled with steam to help with congestion and other symptoms. We can also use medication to reduce fever, such as acetaminophen and ibuprofen. You can also use calming measures to keep the child comfortable, like staying in the caregiver's or parent's arms and avoiding unnecessary accidents. And so for in the healthcare setting, we try to keep the child in a semi-Fowler's position so that for a maximal lung expansion to prevent secretions. Also providing fluids for the child and other medications as well, like as mentioned in the previous intervention. And then you can also observe and consistently check the heart rate and other vital signs for tachycardia, tapnea, sternal wall retractions, and hypoxia.
For evaluation, as parents, we often ask ourselves, how will I know when my child starts to feel better? Since croup is caused by the same viruses that causes a common cold, croup does not last very long. Croup symptoms usually go away within 3 to 7 days, and the child should start being able to breathe normally without any distress. The coughing should be reduced, and they should have more energy around day 4, increased appetite, and the child may return to school and participate in daily activities once the virus has passed.
So treatable versus curable. Because it is a viral disease, there is no cure for croup, but there is treatment. So at home, parents can give fever medications such as ibuprofen or acetaminophen. Over-the-counter cough medicines aren't recommended for children under 4 years old, and they don't aid in croup symptoms. And in the hospital, nurses will can administer corticosteroids and nebulized epinephrine in order to loosen the secretions in the airways. And reinfection. So because it is viral, croup can be contracted more than once from the ages of 6 months to 3 years. Thank you so much for watching this presentation on croup.